Hi, everybody. Welcome to Introduction to the Human Skeleton. My name is Dr. Jump, and I'll be your professor for this course. So, welcome to this, what I will call a mini course, in which I'll provide some overview and some basic details for the skeletal system. So, I'm attempting to break this down into smaller bite-sized chunks so you can learn this a little better, a little bit more efficiently. So, what's in the course? What I'll do is I'll have 6 videos here. And so videos 1, 2, and 3, I'll introduce the terms that we need to know well to learn the skeletal system well. So in videos 1 and 2, I'll introduce terms that we use to describe structures related to one another. For example, medial, lateral, etc. So how do we describe, for example, the thumb related to the pinky? And so we'll see as we dive into these terms that the thumb is lateral to the pinky, and the pinky is medial to the thumb. And so you'll know these terms well as we dive into various components of this course. And then video 3, what I'll do is I'll describe terms of movement. So this is how the body moves related to structures within itself. So if we bend our elbow and then we extend our elbow to make it straight, we are flexing at the elbow and then we are extending at the elbow. So I'll talk about how the muscles move our joints, and so we're basically talking about how skeletal structures are moving related to one another. So then in videos 4, 5, and 6, I'll introduce the basic regions of the skeletal system. So video 4 will talk about the upper limb, and those are the bones associated with the upper limb listed below. So scapula, clavicle, humerus, radius, ulna, wrist, and hand. Video 5, I'll introduce the lower limb. Those are the bones that are associated there: the pelvis, femur, tibia, fibula, ankle, and foot. And then in video 6, I'll introduce the axial skeleton. And you can see the bones associated there: the vertebral column, the ribs, sternum, hyoid bone, and skull. So I'm introducing terms related to regions now, and so we'll dive into detail as to how you probably already refer to these different regions in everyday language. So to learn anatomy well, you really need to know these basic terms. You need to know the terms that you see to the right on the scapula, like superior, posterior, medial, lateral, inferior, and be able to use these as they relate skeletal structures to each other. And so a hint here, as you learn the skeletal system and as you learn anatomy in general, is try to find one key landmark on a bone to orient yourself. So, for example, with the scapula there, I like to use what number 1 is pointing to as a really good posterior or to the back landmark. So number 1 is pointing to this structure called the spine of the scapula. And so this structure is always located on the back of the scapula or the posterior surface of the scapula. So as soon as I find that, I know right away that I'm looking at the posterior scapula. I also use another structure, which we'll see later, called the glenoid fossa, which is a perfect lateral landmark. And as soon as I see that, I know, okay, right away I'm looking at lateral. So that's a hint going forward as you learn the skeletal system, is try to find a key landmark and use that key landmark. You can do this for learning muscles or nerves or anything else in anatomy as well. So then as we dive into video 3, for example, we'll talk about terms of movement. So we're describing how the muscles are moving our skeletal system, how the parts of our body are moving in relationship to each other. So we'll talk about movement forward, backward, to the side, in circles, back toward the body, for example. So many activities are actually involving multi-joint movements. That is, we're moving all kinds of joints within the body. So for example, kayaking is involving movement at the shoulder, the elbow, the wrist. We're stabilizing the core. That is, we're using the muscles of our back to keep ourselves upright. Same thing with abdominal muscles. And so with each movement here of the oar, we're moving each of these joints, and so we can actually describe movement at all of these joints or each of these joints as we perform that movement. So just as an overview here, before we get into the subsequent videos, the upper limb is, in common everyday language, we typically just call this the arm, but it actually consists of various components, which is arm, forearm, wrist, and hand. And also the shoulder is part of this as well, which we'll dive into here shortly. But here are the bones of the upper limb. So from left to right at the top, we have the scapula, commonly known as the shoulder blade. Then we move to the right. We see the humerus, the bone of the arm. Then we have ulna and radius. These are the two bones of the forearm. Then bottom left, we have the clavicle, commonly known as collarbone. And then we have the wrist and the hand there, bottom right. All bones of the upper limb skeleton. Here's the lower limb. And so the lower limb, in common everyday language, we typically just call this the leg. But the leg, the lower limb consists of pelvis, thigh, leg, ankle, and foot. And so to the right, you're actually seeing the pelvis, and it's connected to the bone of the thigh, which is the femur. So let's take a look at these various bones. So far left, we have the bone of the thigh, the femur, and then below that, we have the tibia and the fibula. In the middle picture, we see the pelvis attached to the femur. This is another example of a ball and socket joint. And so we can actually see that the socket is the pelvis, and then the ball is the head of the femur there. And then far right, we see a more close-up image of the bone of the thigh, which is the femur. Then in these images, left we have the tibia, and right we have the fibula. These are the two bones of the leg, technically. And then we have the ankle and the foot here, the last component of the lower limb, which we commonly just call as leg. But you've seen already that we have various components of that lower limb. Then the axial skeleton, these are all the skeletal structures in the middle or the central part of our body. So you might want to think the axles on the car. The wheels rotate around the axles. And so the axial skeleton provides a way to anchor our limbs to the central part of the body, and then we can rotate, we can move based on this anchoring to the axial skeleton. So to the right, you're actually seeing a component of the axial skeleton, and that's the skull. So in this set of images, you're seeing top left, you see the skull. So inside the skull, we have the brain, our eyeballs, various nerves that control our senses like smell and vision. Top right, we're seeing the sternum, commonly known as breastbone, and we see the ribs attached to the lateral part of the outside of the sternum. And then the lower image is showing you three separate parts of the vertebral column, which we commonly just call the spine or the backbone. All of these are components of the axial skeleton, and so we're not seeing all the components. I'm giving you a snapshot here of the axial skeleton. So stay tuned. I've given you a little bit of an overview and a teaser for this mini course that you'll see. And in the next video, what I'll do is I'll describe to you our first set of terms. We'll look at medial and lateral, anterior and posterior, and I'll describe to you how we use these terms to relate various structures on the skeletal system to each other. So I'll see you in video 1.